COVID-19 Pandemic Preparedness Plan. Today we will break down the new Pandemic Preparedness Plan and discuss the following elements. We will go over the purpose of the plan. We will define what a pandemic actually is. We will look at various control measures to reduce the spread of a disease, the required annual training to ensure readiness. And finally, we will provide resources for information as it relates to our company and a pandemic situation. Our company strives to provide a safe and healthy workplace for all employees. This pandemic preparedness plan outlines the steps the company takes to safeguard employees' health and well-being during a pandemic while ensuring the company's ability to maintain essential operations and continue providing services to our customers. This planned response details our preventative measures, business continuity plan, and response to operational concerns. The World Health Organization defines a pandemic as a disease epidemic occurring worldwide, or over a very wide area, crossing international boundaries, and usually affecting a large number of people. A pandemic poses serious global threats to public health and the economy, causing productivity losses from absenteeism, payouts of sick leave, and workers' compensation, lost sales, and disrupts transportation and communications services. Control measures. The company takes a number of steps to minimize exposure and the spread of infection in the workplace. The first we will discuss is social distancing. In a pandemic scenario, employees are required to exercise social distancing as a means of preventing the spread of any virus, bacteria or disease. The company requires employees to limit social gatherings and to maintain at least 6 feet of distance from others, when possible, especially those expressing symptoms. Another control measure is remote communications. All meetings and training sessions, both inside and outside the company, shall be completed through remote channels. All safety training will be recorded and remotely streamed. The training will include a general safety topic and updated Center for Disease Control pandemic information and be distributed to all employees. Personal protection equipment. The company maintains supplies on site of recommended personal protection equipment for the pandemic experienced. We urge all employees to speak with their personal physician about types and proper use of personal protection equipment in the home. Cleaning and disinfecting. Employees are required to use provided cleaning agents to disinfect their work areas throughout the day to prevent unwanted spread of any virus or bacteria. Surfaces should be cleaned using a detergent or soap and water prior to disinfection. For disinfection, follow the manufacturer's instructions while using diluted household bleach solutions, alcohol solutions with at least 70% alcohol, and common EPA-registered household products. Vaccinations. The company strongly encourages employees to maintain up-to-date vaccinations and annual flu shots, if available and not medically contraindicated. Travel. All company out-of-state or international air travel will be suspended. Employees returning from any air travel, both foreign and domestic, are required to do one of the following before returning to work. Provide negative test results. Fulfill an assigned layoff separation period, time subject to longevity of the infection. In the case of COVID-19, the layoff separation period is 14 days. Possible exposure. Employees who become ill or have been exposed to virus/pandemic are required to stay home and seek medical attention as necessary and appropriate. Employees are required to report their illness to their direct supervisor as soon as possible. Employees are required to wait a minimum of 72 hours following last experienced symptom before returning to work. All employees are at risk of exposure to pandemic viruses, both in and outside the workplace. Therefore, the company requires all employees to attend initial and/or refresher training annually to be informed about what to do when a pandemic outbreak occurs and methods to reduce spread of any virus or bacterial disease. Training addresses information summarized in this document and, more specifically, flu shots, symptoms and health effects of a pandemic, treatment, and sources to contact for appropriate medical care, Steps to take if exposure is suspected, company representatives to whom to report known or suspected exposures, and procedures for reporting exposure to co-workers, family members, friends, or others who are ill, proper use provided, proper hygiene in the workplace and at home, and communications. Supervisors and the safety department are responsible for recording and maintaining documentation on every employee's participation in required training. The safety department is the primary resource for information on any pandemic as it relates to the company. Employees are encouraged to stay up to date with the Centers of Disease Control website at www.cdc.gov. Incident Review. The following is an incident review from an incident occurring 3/17/20 in Troy. Description: crew completing an open loop in residential neighborhood. After completing the pre-job brief and confirming positive response, the crew hand-exposed all facilities within the proposed bore path, including a primary at the base of a newly retired utility pole. As the laborer cleaned dirt from the primary with a spade shovel, the primary pulled from an unseen joint and blew the fuse on the new utility pole. The laborer stopped all work and barricaded a safe distance around the area for public safety before contacting the foreman. The foreman made the appropriate contacts to report the damage and facilitate repairs. Upon further investigation, the primary was live at the pole but had been stood off in the transformer. The primary was disconnected at the utility pole and did not require any repairs. The crew was replacing the section of cable. Equipment failure. The primary joint failed. Preventative measures. The incident will be communicated to all crews to heighten awareness to the probability of encountering these primary joints. Management will review incident. Pictures were taken for any other investigations.
COVID-19 is a highly contagious coronavirus closely related to the SARS and MERS viruses. COVID-19 appears to be more easily transmitted than either SARS or MERS, but less severe. Illnesses associated with COVID range from mild to severe, including respiratory issues resulting in death. The virus seems to have a greater effect on people over the age of 60 and people with underlying health conditions like heart disease, lung disease, or diabetes. Time from exposure to onset of symptoms is generally between 3 and 14 days. Health officials believe the virus is spread via droplets in the air or on surfaces. Patients with confirmed cases report mild to severe respiratory illness with symptoms such as fever, cough, and shortness of breath. The virus may cause pneumonia in some severe cases. If you have been exposed to someone with the virus or who has returned from an area with known infections, implement a self-quarantine for 14 days. If no symptoms develop after 14 days, you may return to your normal routine. You should follow your company's policy in the event you expect to have come in contact with the virus, which may include various precautions as instructed by your healthcare provider and/or employer. If you develop symptoms, alert your healthcare provider immediately. Do not travel to a physician's office, clinic, or emergency room without calling a local healthcare professional first. Be prepared to discuss your symptoms, any recent travel, and any exposure to someone with the virus. The healthcare professional will direct you to the proper facilities that can test for the virus. Your healthcare provider can determine if your signs and symptoms are explained by other causes, or if there is reason to suspect you may have the virus. If laboratory testing is appropriate, your healthcare provider will work with health officials in your state to collect and test any clinical specimens for diagnosis. Typically, a sample is taken using a nasal swab. The best practice is to avoid being infected in the first place. So, how can I protect myself? Wash your hands with soap for at least 20 seconds. Yes, 20 seconds. Dry your hands with a disposable towel. Use a clean towel to open the bathroom door to avoid touching the handle with your clean hands. If soap and water facilities are not available, disinfect your hands using a sanitizer with a greater than 60% alcohol content. Practice respiratory etiquette at all times. Cough or sneeze into a disposable tissue and discard. If no tissue is available, sneeze or cough into your elbow. Remember, any virus passed onto your clothing may live for a week or more. Wash your hands as soon as feasible or sanitize your hands. Avoid touching your face, especially your eyes, nose, and mouth, unless your hands are freshly washed. Avoid shaking hands. Use an elbow bump, small wave, or foot tap as a greeting instead. Use your knuckle or elbow to touch light switches, elevator buttons, etc. Use sanitizing wipes to clean off shopping carts and baskets. Use credit cards, not cash, to make purchases to avoid handling money. Open doors with your closed fist, forearm, or hip. Avoid grasping door handles unless there is no other way to open the door. Especially important on bathroom and public doors. Keep a bottle of sanitizer available at each of your home's entrances and in your car for use after touching potentially contaminated objects, such as a gas pump, when you can't immediately wash your hands. As we fly on airplanes, consider bringing disinfectant wipes for travel both to and from a destination, to clean the seat space and related equipment, seat tray and lock, seat belt, air vent, armrest, etc. Also, the aisle seats are said to be the ones where there is most likely transfer of virus, given the aisle traffic and passage by of row seatmates. Consider turning on air vents, but positioning them in a manner that directs airflow toward other passengers who may be coughing and sneezing or exhibiting signs of a flu. Remember, this virus appears to spread in droplets by coughing and sneezing. The surfaces where these droplets land may be infectious for a week unless cleaned and disinfected. Respiratory etiquette and hand hygiene are the best defenses. If you have not been vaccinated for seasonal flu, it is not too late. To keep the healthcare system from dealing with seasonal flu issues, make sure to get a vaccination. The flu vaccine is not effective for COVID-19, but it may keep you from needing medical care for a preventable disease. If you have a family member over the age of 60 or with underlying medical conditions, what should they do to protect themselves? Beyond the previous advice, they should ensure that they have a sufficient supply of prescription and over-the-counter medications for their conditions. Avoid sick people, even grandchildren. Restrict their travels and avoid large gatherings. They should also immediately contact their healthcare provider if they develop any symptoms. Remember, there are two critical things to help minimize your chance of contracting any virus. 1. Wash your hands often and thoroughly for 20 seconds and avoid touching your face. 2. Practice respiratory etiquette. More information can be obtained from the CDC. Stay educated, stay safe.